So welcome everyone to Sweet Life Talks. We are so happy to be here today with you all. Thank you for coming. Sweet Life Talks are sponsored by Abbott, and once a month we get together with someone who we think is very smart in the field of diabetes and ask them to share their knowledge with us. And I'm so happy today to have Daniel Sher here. Daniel is a clinical psychologist practicing from Cape Town, and he's lived as a type 1 diabetic for over 30 years. So he uses his personal experience and professional training to empower other type 1 and type 2 diabetics to thrive. What we did this time for the Sweet Life Talk is I asked on Diabetic South Africans on Facebook if anyone had any questions about diabetes and mental health that they wanted to ask Daniel, and then we've collected those questions together, and I'll be asking Daniel the questions during this next hour. And if anyone has any questions, please feel free to ask them in the chat function. I have muted everyone so that we can hear Daniel speak, but yeah, we'd love to ask any other questions in the chat function. Daniel, over to you to introduce yourself, please.
Great. Thanks for the introduction, Bridget, and thank you everyone for joining today. These monthly talks, I think, are a really fantastic initiative, and I'm really glad to be here. So, as Bridget has mentioned, I've had diabetes now for nearly 30 years. I'm a type 1. And I work as a clinical psychologist. And although it's not the only work that I do, my primary passion in my work is working with other people who have diabetes, both type 1s and type 2s. And my goals in my work are basically twofold. The one is to empower people with diabetes to address any psychopathology, any psychiatric illnesses, which might be stopping them from being able to live their lives to the fullest. And the other branch of work that I do is more along the lines of lifestyle coaching for people with diabetes who want to really be able to thrive with this condition. So just in terms of the link between my experience of diabetes and my entrance into the world of psychology, I didn't realize that I was going to be a diabetic psychologist per se. In fact, when I was younger, growing up with diabetes, I don't know that there was such a thing. Very few people with diabetes actually ended up speaking to psychologists. So I went into my training as a psychologist, not particularly interested in doing this sort of work. But it was when I did my government community service at Khayelitsha District Hospital that I started to notice the overlap between psychiatric issues and diabetes. I mean, the patients who I was seeing there, it was rare for one of them to not have type 2 diabetes. And, you know, despite all the cultural and language and socioeconomic barriers which existed between us, I found the common ground of diabetes really helped us to connect on a level that really promoted healing for them and a huge amount of learning for me. So that's how I ended up where I am today. And yeah, very excited to be doing this work.
Wonderful. And it's such a relief, I think, to have someone who understands what it's like to, because if you have to spend half of your first session trying to explain what it's like to live with diabetes, that's such wasted time. Whereas with you, I'm sure there's immediate shorthand. So our first question from Kirsten, she said, how do you know if you suffer from anxiety or if it's just symptoms of sugar highs and lows? The symptoms of the highs and lows seem so similar to anxiety, from the heart palpitations to the sweating and feeling disorientated or antisocial. So how do you know if it's actual anxiety or if it's just crazy fluctuating blood sugar?
Yeah, thanks, Kirsten. I think that's definitely a very relevant question, and probably one that, you know, as people with diabetes, we've all considered, you know, is what I'm experiencing a symptom of hypo or hyperglycemia, or is this just plain old anxiety? I mean, the symptoms overlap. And in fact, one could say that when you're low, the symptoms that you experience are technically anxiety symptoms. This is because when you're low, this triggers a cascade of hormones into the bloodstream, which elicit certain responses in your body, in your mind. And these responses are basically the typical anxiety responses. We all know what it feels like. The sweatiness, the clamminess, the shakes, the rapid heart rate, the confusion, the dizziness. I mean, all of these are physiological signs of anxiety and physiological signs which indicate hyperglycemia. So it's quite hard to tell them apart. And what makes that task even more challenging is that when you have a severe low, the hormonal response from your body continues for 6 to 8 hours afterwards.
What?
So,
6 to 8 hours? Any low?
6 to 8. Well, I imagine that the more severe the low is, the longer the response will be. Obviously, it attenuates. So, I mean, once you treat the low, the majority of those symptoms lower. But some people, especially those who are, quite sensitive on a physiological level and quite hyper aware of what's happening in their bodies, they may find themselves having residual symptoms of anxiety that persist after the low, that are technically, triggered by the low. So, I mean, it just makes it very confusing for us. But one strategy which I've found to be helpful in teasing the two apart is keeping a journal. And now, as diabetics, we all know that back before our CGMs and our Libres and our Dexcoms, we were asked to keep those manual diaries of our blood sugar levels. I bet none of you were asked to add in your emotions as well.
I love it.
Absolutely. It's a really nice way to notice trends. And if you're finding that when your blood sugars are up and down, your moods are also corresponding to that, that's probably indicating that these symptoms are closer to a normal diabetic response to low blood sugar. But if you're finding that your anxiety or irritability or fear or low mood is consistently high, even when your blood sugar is well controlled for extended periods of time, that's when we want to start thinking about the possibility of an anxiety disorder.
Okay, great, thank you. My mind has been slightly blown about the fact that that anxious feeling after a low can last for so long. And now that you say it, I feel like it makes a lot of sense, because you feel kind of shaky afterwards, and that can last. I mean, I feel kind of shaky, and that can last quite a long time. And same with the highs. I always notice that I am suddenly snappy and grumpy when my blood sugar is high, but it can stay like that. It's not that it goes away as soon as you're back in range. Like the emotional component can stick around. Okay, so there was
Sorry to interrupt. I'm just thinking, another thing that as diabetics we're all familiar with, it's the roller coaster. When you overcorrect, blood sugars go low, they go high, they go low. I mean, personally, I find if I have one of those roller coaster rides in the morning, I'm going to be feeling off for the rest of the day, even if my blood sugars are fine, even if they stabilize. I'm not sure if that, I imagine that may well be a common experience for quite a few people.
Yeah, absolutely. I've noticed the same thing. And you kind of want to write the rest of the day off, but unfortunately, life doesn't care about diabetes that much, so it's gone. There were a lot of questions about diabetes and anxiety. So many people mention it, more actually than diabetes and depression, which surprised me. So I kind of amalgamated from Lee, Nomzara, and Monique, all had a version of, why do I have anxiety even when I've taken my anxiety meds and my blood sugar level's okay? So how come, even if I'm not on the roller coaster, blood sugar seems fine, I'm taking the anxiety meds, and it's still not leaving me alone?
Yeah. So I think it's probably helpful here for us to, I've already alluded to this, but we need to think about anxiety and anxiety disorders as being separate things. Okay. Because, anxiety, if we think about it physiologically, psychologically, what happens in our bodies, what happens in our minds, we can basically equate that to a fear response. And fear is a natural response which everybody experiences. So theoretically, we could say that all people experience anxiety at times. And in fact, we could even say that it's adaptive. It's what keeps us focused. It's appropriate. It stops us from, running out into a highway. It stops us from walking out without masks on, because, there's a real threat there that we are being protected by our anxiety. However, an anxiety disorder can be diagnosed when that anxiety is happening all the time, when it's not easily controllable, when it's really interfering with your capacity to live your day-to-day life. That's when we start to think about the possibility of a psychological disorder, which is characterized by anxiety. So generalized anxiety disorder is one of the most common ones. And for the people who ask the question about, my blood sugar level's fine, I'm on anxiety meds. I guess the fact that you're on anxiety meds in the first place speaks to a likely anxiety disorder, which is separate from the diabetes, but is still made vulnerable to that by the diabetes. And what I would recommend is if you're experiencing that, firstly, go to the person who prescribed the medication and ask for a review. Sometimes, the dosage needs to be changed, the medication needs to be changed. And the other thing, which of course, as a psychologist, I would be recommending this, psychotherapy is a really, really good way to target anxiety and to learn to control it.
So you said that anxiety and diabetes are related, but you just said something beautiful, and I wish I'd written it down. The anxiety is made vulnerable by the diabetes. What do you mean by that?
Okay, so
they feed into each other.
So it gets pretty complicated, but essentially, so most people with diabetes experience symptoms of anxiety, just like everybody else, except arguably we experience them more frequently. But there's also some literature to suggest that as a result of having diabetes, we're made more vulnerable to developing anxiety, which is an anxiety disorder and not just an adaptive everyday instance of those symptoms.
Okay.
So,
and do you think that's because of the diabetes stuff, like the fact that we are actually at risk of glaucoma if I take too much insulin and don't check my sugar before bed? Do you think it's as linear as that, or is it because there's almost always too much going on in our heads, or is there not a straight line?
Look, yeah, the link is very complex. And to be honest, we don't know entirely why. But the theories that have been put forward to explain the link between anxiety and diabetes are very similar to the ones that have been used to explain the co-occurrence of depression and diabetes. Okay. And I think maybe let me get into that in a bit more detail when we get to the depression question, if that's all right.
Well, what do you know? The next question is depression and diabetes really common. So there are a bunch of questions. There are a bunch of questions about diabetes and depression in general. So if you could speak to that, and then I want to ask you about medication. So let's start on depression. Is diabetes and depression very common?
Absolutely. I mean, some of the statistics that have been drawn up, for example, lifetime prevalence of depression for a person with diabetes, as in, if you have diabetes, the chance of encountering a major depressive episode at some point in your life is 29%. Now, the general population, if I remember correctly, lifetime prevalence is 12% max. So what this is telling us is that we are, as diabetics, up to 2 or 3 times more likely than other people to develop depression. And again, when I say depression in this instance, I'm not talking about feeling sad, because feeling sad is natural, even healthy. I'm talking about clinical depression, known as major depressive disorder, which involves persistent experiences of sadness, but it also involves a whole host of other neurological, physical, cognitive, emotional symptoms.
And why?
Yeah, good. Thank you. That's where it gets interesting. And please redirect my thoughts if I'm getting too technical here, because it's some pretty confusing but fascinating theory that links these two. Okay, so firstly, I've got a colleague in the States, Dr. Bill Polonsky. He's a fantastic speaker and diabetes doctor and psychologist, and he uses a metaphor to explain the indirect link, how diabetes can lead to depression indirectly. The metaphor he uses is, he says, the universe has given you a new job. You didn't ask for the new job. It's a full-time job. You don't get holidays. You don't get paid. And in fact, it's a job that you have to pay in order to keep.
And inject yourself. That's part of your daily routine.
Exactly. I mean, life's busy enough without all of the things that we need to think about. And, that can get a bit overwhelming at times. And that can indirectly lead to symptoms of depression, understandably. But there's also research that suggests that there's a more direct, and when I say direct, I mean pathophysiological link. There's something in the biology of depression and diabetes that allows these two conditions to exist in parallel. And the way that we know that, for starters, there have been studies showing that, okay, so we know diabetes predicts depression, but there's also been research to show that if you have depression, you're more likely to develop type 2 diabetes. When we ask why, the answer, okay, it might seem obvious. If you're depressed, you're more likely to eat the wrong food, you're not likely to be motivated to exercise, etc. But the research is controlled for those factors, meaning that even accounting for those effects, a person with depression is still more likely to develop type 2 diabetes. And that's speaking to a biological connection, something that's happening in the brain that makes these two conditions co-occur. And that's been followed up by some really interesting MRI brain scan research, which has found that fluctuations in blood sugar leads to different patterns of activity of glucose and blood flow in the parts of the brain that are responsible for mood and cognition, the same parts of the brain that are affected in a person who's depressed.
That is fascinating. Depression and anxiety, I don't know that I understand the link. Because to me, so I'm completely elated and I know nothing about this. To me, depression is like all the down emotions, and anxiety is all the hyper emotions. And are they often paired, or is it a similar part of the brain? Or so does the same thing apply for anxiety and diabetes as depression and diabetes?
Yeah, good question. So depression and anxiety, they're different psychological disorders with different clusters of symptoms. And basically what you've said is accurate. Depression is usually characterized by a lack of energy and a sadness, whereas anxiety is often a slightly more stimulated, worried, fearful, activated response. But the truth is there's a huge degree of overlap between the symptoms, and the two disorders co-occur incredibly frequently. And we think that both disorders are linked to serotonin dysregulation. And that's why, for example, if you go to a psychiatrist, whether you have depression or anxiety, the treatment that you're most likely to get is a serotonin regulator, as in an antidepressant. So there's a link. However, the research that connects diabetes and depression, we don't have that much data connecting it to anxiety. It's not as strong. We don't know exactly what is entailed in that link.
To me, I find it so fascinating because I wouldn't have thought that there would be a medical link necessarily between depression or anxiety and diabetes, but the emotional and mental link makes perfect sense to me. So one of the questions that wasn't asked that I'm just going to throw in, okay, is diabetes burnout, because I think it's something that we don't necessarily talk about enough, but we're living with a chronic condition that is exhausting and impossible to master. And impossible to master this is what drives me nuts, and I know what drives a lot of other diabetics nuts, because you can eat exactly what you're supposed to eat. You can inject exactly the same amount you injected for the same meal yesterday when your blood sugar remains stable, and any of a number of factors come in. And I think it's so easy to lead to periods of burnout where we just want to give up and pretend it's not happening. And what do you recommend when people come to you with diabetes burnout?
Yeah, that's also, it's a brilliant question, and it speaks to an area of research that has been flourishing. A lot of it coincidentally spearheaded by Dr. Polonsky, who started speaking about a concept called diabetes distress, which is essentially diabetes burnout. And diabetes burnout, if I remember correctly, affects approximately 40% of diabetics.
Yeah.
And my wife will appreciate this one. It also affects approximately 20 to 30% of spouses of people with diabetes.
Yeah, it's exhausting. One of the things when we started Sweet Life as a magazine, I said we have to have a section for the partners of people with diabetes. So we still have a whole section on our website that's like for the parents and the kids and the husbands and the girlfriends and the siblings, because it affects the whole family, but often it's only the one who's living with the diabetes that gets the attention.
Yeah, 100%. It's massive. And I think to really work effectively to empower someone with diabetes to manage their condition, you need to be working with the people around them as well, which I often do. But Bridget, just to jump back, I realize I did not completely answer your question. With diabetes burnout, there are multiple things that we can do. Psychotherapy, again, is something that I frequently use, and I draw on cognitive behavioral therapy intertwined with diabetes-focused strategies, knowledge of the day-to-day life of a diabetic. And sometimes that incorporates what other practitioners in the field have referred to as, well, some people call it a cheat day, but I don't think that's accurate. It's a holiday. And it's
sounds lovely.
Yeah, I mean, I think it's useful, to create a window of time, however often you might need it, where you can allow yourself to safely relax the restrictions with which you're constantly grappling. And obviously, it's very important that this is done safely. You can't exactly go and swallow a liter of chocolate ice cream. But you might want to have something to eat that you wouldn't normally eat. And as long as you're bolusing for it appropriately, I find it can be really therapeutic to just allow oneself to enjoy a brief respite from the demands of this condition.
One of the things I find so fascinating, and then I will get back on track, I promise, is how many type 1 diabetics I've met, particularly diagnosed later in life. I was diagnosed at 25, who are A-type personalities and like to be in control of things and like to be on top of things. And it is like we have been, Shelley's laughing, she recognizes me. It's like we've been handed the most frustrating possible conditions for our personality type. And I think sometimes that letting go a bit and having like a more relaxed day, or like eating something you're not supposed to, or just letting go a little bit, can be such a relief to that part of our personality that is never satisfied, because there is no such thing as a person diabetic. But yeah. Okay, back to the questions. So a bunch of people, Llewellyn and Elmarie in particular, were asking about depression drugs, because they said there were a bunch of there was a bunch of different medication they were put on that was affecting the diabetes as well. I know you are a psychologist, not a psychiatrist, but I was wondering if you had anything to speak to that.
Definitely. So I work with a team of psychiatrists who I refer to frequently. And having spoken to them and looked at the literature, Wellbutrin is a very commonly prescribed antidepressant. And it's appropriate in particular for people with diabetes because from a metabolic perspective, it has a positive impact. It can help with insulin resistance, it can help with weight loss, and it can also energize you to a certain extent. Duloxetine is another popular and effective antidepressant. And then the SSRIs are probably the most commonly prescribed class of antidepressants. That's sertraline, fluoxetine, Celexa, all of those sorts of things. Basically, people with diabetes can take the first-line antidepressants that are prescribed to people without diabetes. Having said that, there are some antidepressants which can have a negative metabolic effect and can negatively affect your diabetes. So please don't take antidepressants unless it's prescribed by a psychiatrist who's given you a proper assessment.
And you know you're diabetic, obviously.
Oh, absolutely. I was going to say though, I mean, you know, being a psychologist, psychotherapy is what I use to treat depression in people with or without diabetes. And what the research says, on average, antidepressants and therapy have the same level of efficacy, but that efficacy is increased when the two are combined in a way that takes advantage of the synergistic dynamic that can be established between therapy and antidepressant use.
That makes sense. So you're being augmented to be able to get to the bottom of the problem.
Right.
If there is a bottom to the problem.
Yeah, yeah, that's a good point. And there isn't always, but I guess
Yeah.
that's part of the journey. That's part of the process, learning that sometimes sadness is something that needs to be embraced, much in the same way that you said, for people who have a slightly type A personality structure, I think a big part of learning to thrive with diabetes is learning to be okay with those moments when you're not completely in control, because they're inevitable, right?
Slightly type A is a very kind way of putting it. I realized the other day, I'm just going to go with it, that I'm so kind to myself about coughing when I'm miscalculating. So like I was making white sauce in the microwave and it overflowed all over everything. And I was like, oh well, like I obviously put it in for too long, I just miscalculated. And there was no sense of like, oh, I'm an idiot, why did I do that? Like, how could I have done that? How could I have miscalculated wrong? And yet with diabetes, because the decisions I think are so personal, because it's about our food and we're injecting into ourselves and it's the decisions that we're making, there's such a value judgment attached to whether we go high or low. And I find particularly for me, less if I go low. If I go low, I'm like, oh, well, I guess I injected too much. But if you go high, it comes with this whole bouquet of like, well, I shouldn't have eaten that, or I should have waited longer with white. And I find it fascinating and I don't really understand it.
Yeah.
I'm just going to get some free therapy, yeah.
You're welcome, Bridget. But I mean, isn't it interesting how, what you're talking about there, paradoxically, those thoughts feelings of emotional distress, which can then develop into depression or anxiety, which on a physiological level makes it more likely that your blood sugars are going to go high or go higher, or that you're not going to respond to insulin. It's such a strange, vicious cycle that can be established there.
That leads us perfectly into, can we talk about the effects of stress on our blood sugar? So Jonathan wanted to know, he said, I suspect that stress alone can increase our blood sugar by 50%. Is this possible? A lot of people were talking about stress and blood sugar.
Yeah.
What do you have to offer? Anything?
Sure. 50% is significant. I think it's very hard to say exactly how much blood sugar variation is caused by stress, just because there's so many variables at play. Having said that, Jonathan, I did dive into the literature to see what I could find, and I found one, albeit slightly vaguely phrased and slightly poor methodology. There was a study that found that what they called negative emotions, including stress, led to a 79% increase in blood sugar levels.
Whoa.
I mean, that's really significant. I'm not sure how they would have gotten to that. But all of this makes one think about, what is the connection between stress and blood sugar fluctuations? Can stress lead to blood sugar rising? Absolutely. Why? Okay, so this is, I find this fascinating because it makes us think about how something that for a diabetic is a problem is something that's adaptive for somebody who doesn't have diabetes. So when we get stressed or anxious for that matter, or depressed to some extent, it triggers an interaction of hormonal and neurological factors. And researchers call this the Hpa Axis. What's happening is the hypothalamus in the brain speaks to the pituitary gland, which then speaks to the adrenal gland. And as a result of all of that communication, we get a cascade of hormones that get pumped into the bloodstream. And we also get glucose dumped by the liver into the bloodstream. The hormones that are in the bloodstream include epinephrine, which is adrenaline, cortisol, which is a stress hormone, and glucagon. So glucagon should raise a red flag for all of us. That injection that's in your fridge and that's most probably expired, that the lifeline when you're so low that you're unconscious and your poor wife has to stab you with the glucagon to bring you back to life. That glucagon, its job is to boost glucose in the bloodstream. So the same thing happens with the cortisol. It's making insulin less effective. It's increasing the availability of glucose in the bloodstream. all of these changes are geared to increase the amount of glucose that we have in our blood so that we can respond to what's causing the stress. So if it's, you know, a saber-toothed tiger that has jumped out from behind a boulder, we need to be physiologically ready to fight or flee or freeze. Hopefully not freeze, it's not the best response in that situation. But basically what this is saying is that it's adaptive for us to have high blood sugar in response to stress. But if you're a diabetic and if you're having stress that is chronically reoccurring, then that's going to cause persistently high blood sugar. It's going to cause insulin resistance, and it's going to cause also some pretty nasty effects on the brain, including changes in the hippocampus, for example, which can lead to dementia. And all those.
So what do we do about it?
Yeah, good question. I mean, you know, there's certainly, you know, certainly stress can be managed. And there's a lot of good evidence-based research to suggest what can be done to manage stress effectively. This is important for everyone, but I mean, it's so much more important for us as diabetics. The first thing, we've all heard this before, physical exercise, get moving. And I know it's not always easy in the time of lockdown. If we don't live in a safe community, it's not all that easy to go for a short 10, 15-minute walk, which can really help reduce stress. But you can always do things inside. You can do yoga, you can do aerobics. In fact, Bridget, I'm sure you know our colleague, Nicholas Karakandis, the Diabetic Athletic, he released, videos of short workouts to do during lockdown when nobody could work out. And that's a really great resource if anybody is looking for some exercise strategies to lower stress levels and manage your glucose. I'd recommend checking that out. The other things you can do, make sure you're getting enough sleep and make sure you're getting good quality sleep. If you're not sleeping properly, you're going to be more stressed on a physiological level. Meditation is an awesome strategy for reducing stress, targeting anxiety, targeting depression, and in the long run, improving blood glucose control. So mindfulness meditation in particular has received a lot of attention in the scientific literature, and it's seeming to be a pretty effective way to reduce stress. And there are two apps that I can recommend.
Honestly, like often just focusing on your breath, and as your breath comes in and as your breath, mindfulness meditation is really as simple as it gets.
It's incredibly simple, but also incredibly effective. And also the cool thing about it is that mindfulness meditation, you don't need to set aside half an hour and be in the lotus position. It's something that you can integrate. You can have a mindful cup of coffee. You can practice mindfulness while you're driving to work. You can be mindful when you're testing your blood sugar. I mean, there's no limit to the way in which it can be applied. And it can be accessed. I mean, there are loads of resources online, but there are two free apps that I can recommend, Headspace and Calm. They're both very good, very accessible, easy to get.
Awesome. Okay, moving on. No, I'm not. What do you want to say?
For people who are struggling with chronic stress and you're not getting it under control, there's a psychotherapy technique called mindfulness-based stress reduction, which draws on mindfulness and combines it with psychotherapy techniques to really give you an edge on those stressful feelings and the consequences of stress. So that's also recommended.
So there's a question now that's kind of like, I think because we're in
Zoom meeting.
Oh, hang on. Yeah, I've just got a phone call. There are a lot of people, I think, going through grief at the moment because of COVID. So many people have died. We all know that. What do you do when grief and stress cause high blood sugar? So Nadine said, I'm struggling with high sugar levels since my sister's passing. And with the current COVID situation at government hospital, we're not seeing any doctors. It's very frustrating. So any words around grief? It's like an extension of stress, I suppose.
Yeah, I mean, grief is such a difficult thing to experience, and a part of what makes it so difficult, and it's unavoidable. However, grief can really throw a spanner in the works of one's diabetes management, especially if you're developing what psychologists refer to as complicated bereavement, which is when there are other factors at play which stop you from being able to process the loss in a healthy, adaptive way. And yeah, so I mean, it's really difficult, you know, when I know the clinics are hugely overburdened at the moment, and at the best of times, it can be difficult to get a combination of diabetes and psychological care from those clinics. What I can recommend, though, is a colleague of mine recently wrote an article, which is now widely available on the web, about how to access psychiatric services through state healthcare. And I don't know,
you
Bridget,
posted the link on the Facebook page.
I did.
You go and find it on Diabetic South Africans, yeah.
Awesome. Thanks, Bridget. You're on it. That really gives you so what I'd recommend is have a look at that article, find out the best way to access the psychiatric nurse at your clinic, and just get a review. Screen for any symptoms which might say that this is not a natural grief response, but a complicated grief response or depression or any other psychiatric condition. And failing that, if you're not able to get treatment for what you're going through, I would just rely on what I mentioned now, those strategies for reducing stress. Those can also help you with grief. They can improve mood, and they can help you with your blood sugar control, which just sets a positive feedback loop in process.
And those were get physical activity, do some physical activity, try and get regular sleep, and try meditation.
Meditate. Yeah. Journaling is also a great one. If you journal about your emotions, there's been research done to suggest that simply verbalizing your feelings or putting them on paper makes those feelings easier to tolerate and cope with.
And what is a natural grief response? Is there such a thing?
I'm not sure if it's you or me, but something is very quiet and still on my side.
Oh dear. Are you glitching? I was asking what a natural grief response is.
I can see other people.
It's her connection, not your.
Oh, yeah, thank you.
It was mine.
Thanks, Sher.
I'm back.
Hey, well,
I don't know what happened.
I'm so glad it wasn't my fault. It's usually my problem with this when there's an internet issue.
That might be me being prompted to stop being such a chatty Cathy. I just wanted to know what a natural grief response is.
Good question. Well, I mean, yeah, look, there's been research done to try and differentiate what is natural from unnatural or adaptive versus pathological. And it's a huge debate, but basically I think if I remember correctly, the time limit that's been placed on appropriate grief, according to the DSM, is 2 months. So if after 2 months, you're
that's
not,
quick.
It is quick. And there's been a lot of critique about that. But ultimately, I think it's about working out whether it feels culturally appropriate. So sometimes you can see when somebody is affected by loss in a way in which they're simply not able to continue with life even after having taken time to try to process that. And that's an incredibly vague criterion that many different people would have different interpretations for. But I think if you it's something
and COVID added such an extra layer of complication too, because so many people haven't been able to say goodbye properly and all of that.
Exactly. It's incredibly complicated what's going on now. I mean, what they commonly say is you need to be able to see and touch the body in order to move on, because that makes the loss real. And whereas, here we have people dying and on a phone call, that's the only contact the family can have with them. It's really difficult.
They're lucky.
Yeah.
Okay, we have one more question, and then this is everyone's final reminder. If you have any other questions for Daniel, put it in the chat. So P-Web wanted to know if diabetes can lead to madness. I know madness is not the clinically correct term, but I don't know what the clinically correct term is.
Yes. Okay, so there are a few conditions which come to mind when I think of the term madness. I think probably what Hpa means in this instance is what we call delirium. Delirium is referred to as an acute confusional state that's caused by an imbalance in the brain of certain neurochemicals and physiological processes. And what it looks like, the person essentially is disorientated, they're confused, they might be speaking in languages that don't exist, they might be hallucinating, there'll be odd behaviors. Having said that, delirium is usually reversed very quickly when the blood sugar when the low blood sugar or the high blood sugar is treated. So it will only happen as a result of extremely low or extremely high blood sugar, unless there's a different disease process going on.
Okay.
The other diagnosis which might be alluded to here is schizophrenia, which is a psychotic disorder. To my knowledge, people with diabetes are not at higher risk of experiencing schizophrenia than others. What's interesting though, is that people who have schizophrenia, and we see the same pattern here, they're more at risk of developing type 2 diabetes. Part of the reason for that is the medications that people with schizophrenia get given are not good for one's metabolism. They lead to weight gain and those sorts of metabolic processes. But that also in the research has been controlled for, and we're seeing that there's something of a link between these two illnesses that we don't quite understand yet. But if you don't have schizophrenia now, I don't think anybody here needs to worry about the link between those two conditions.
Okay, good. That is a reassuring note. So would you like, before I do the whole wrap up, is there any words of wisdom you would like to offer? Wait, Rian has a question, and then now, so you can think at the back of your mind, Daniel. Words of wisdom for diabetic South Africans. Rian would like to know why medical schemes like GEMS don't cover depression medication above limits, with insulin being so expensive. I have to go to a government clinic tomorrow for a second visit to the local government clinic. Why wouldn't they be covering depression medication? Do you know?
It's a whole medical aids and their plus. And personally, I've had a lot of issues when it comes to claiming from GEMS for my patients. And I know that when it comes to mental health benefits, often GEMS isn't as proactive as other medical aids. But what I would encourage you to keep in mind is that depression is a PMB condition, just like diabetes. It's a chronic condition, and there are certain prescribed minimum benefits to which a person has access. Different medical schemes give slight variations on what they're willing to cover and what they're not. But to my knowledge, there has to ethically be some level of provision for that condition. So what I would encourage you to do is to keep liaising with them. I know it's not always easy. And if possible, try to get whoever's managing you for that condition to motivate on your behalf and to help you to liaise with the relevant people there who are going to give you that cover.
And you can also request from your medical aid the list of PMBs, the formulary covered by the PMBs. So find out if you have been diagnosed with depression as a chronic condition, then there must be a list of PMBs, just as with diabetes, of what you would be covered. So that would hopefully help.
Absolutely.
Okay.
I'll just say antidepressants and treatment for depression is available through state healthcare without payments, regardless.
Okay, good to know. So your final word for us, Daniel. Diabetic South Africans, what do you want to tell the Diabetic South African community about diabetes and mental health?
I mean, I think I'm really glad to see how many people are thinking about this. To go from, when I was a child growing up with diabetes, my doctors never thought to refer me to a psychologist. And slowly we're moving in the direction that other countries are moving in, where psychological input is a routine aspect of diabetes care. And it is really, really worth doing, because the research has shown that if you take care of your psychological well-being early, you are basically managing the risk of developing longer-term complications. You're decreasing your risk of mortality. And most importantly, you're equipping yourself to be able to live with diabetes in a way that works for you and actually use this condition to benefit your life. And that's why I like to use the word thrive, because I truly have seen some of my patients embrace this condition and get to a point where they are so happy and fulfilled and just benefiting from the situation. And that's because of the action that they took in working towards improved mental health and self-management.
Great, thank you so much. Thank you to everyone for joining us today. Thank you to Daniel Sher for sharing all your wisdom. Thanks to Abbott Diabetes Care for making this series possible. And next month, it'll always be the first Tuesday of the month. So next month is, I want to say the 5th of October, but I should have written it down. Give me 2 seconds. 6th of October. Tuesday, the 6th of October, we are going to have a dietitian, and we're going to be discussing any questions you have for our dietitian. Please ask on Facebook on Diabetic South Africans, and you can sign up on the same link, which I'll put down here. It was sweetlife.org.za/sweetlifetalks. Thank you so much, everyone, for joining us today.